small community, and I couldn't resist but asking her if she could moderate this session. So and she has done a marvelous job over the years with global affairs, which is also linked um, with at Ohio State University, but I think she has spent more time with uh, in Washington D.C. I think I would instead of sharing it down, I would really let her um, herself, because I don't have the CV, but I know, like, and I have notes through the this small working task force that she is an amazing leader. If you don't mind, Dr. Worko, please say like few words also like about your background.
Okay, Dr. Waku, thank you so much. You have about 20 minutes for you and your panelists, and then we'll open for some questions. Over to you, Dr. Waku.
Thank you so much, Dr. Igbe and Dr. Inauko. It's a pleasure to be here, and thank you for the introduction. I'm currently with the One Health Global Alliance, formerly working as a study director with the U.S. National Academy of Sciences, Engineering, and Medicine. And good afternoon and good morning to everyone that has tuned in. And I'm really delighted to moderate this next panel on AI in continuous training and capacity enhancement. As you heard from Dr. Bakala, who so eloquently provided his opening remarks, AI is reshaping how we teach, learn, and also deliver healthcare services. But I think, as he noted, the African continent faces unique contexts. There are ample opportunities and yet significant challenges around governance and infrastructure. So at this next panel, we will hear from experts who not only will talk about where AI is headed globally, but also what it could mean for African systems, institutions, and ultimately the communities that are served through the systems. So as Dr. Igbe said, we have about roughly, I believe, hopefully about 30 minutes, maybe less, it sounds like. But we'll have a few minutes left at the end for a Q&A. So hopefully folks that have tuned in will have the opportunity to ask some questions. Our first panelist is Dr. Yogita Abichandani. Dr. Yogita is an interdisciplinary researcher and educator. She currently serves as an associate professor of Business Studies at the Management Development Institute of Murshidabad. Second panelist is Ms. Alina Revilis. Ms. Alina is the CEO and co-founder of AI Future Leaders. She also serves as the Director of Data Science and AI at First Home Bank of Canada and is a part-time faculty of informatics at Northeastern University. They have quite an extensive bio. In the interest of time, I'll just keep it short, but a very warm welcome to both of you. So diving right in, and maybe I'll start with a couple of questions to sort of set this stage. And if it's okay, I'll come to you first, Dr. Yogita. So given your experience in human resource strategy, how do you see AI transforming training and capacity enhancement, and particularly focusing on healthcare professionals?
A very interesting question. What we have come to understand of AI is in terms of automation of tasks. What we have not really understood about AI is the fact that it can actually enhance capacity of individuals who are willing to experiment with it and work with it. Now, what has happened is over the years, since the AI has come, especially post-COVID era, we have not understood AI in terms of AI literacy, data analytics, and the implications for ethical governance. And what we require is the workforce which can use the AI literacy as a competency framework, which is where the current challenge is in the market. And we need to make sure that AI is optimizing the workflow and optimizing and reducing the burden at the same time, while the AI literacy also helps us increase our healthcare systems, make sure everybody has equitable access and there is justice built into the system, like initially said by our honorable speaker. So my understanding is for AI and especially for human resource leaders to utilize AI, we need to initially start an audit of what is it that we are lacking in terms of AI, and then also push that it is AI is for augmentation, not replacement. One of the biggest challenges when it comes to AI adoption is that it is considered as a replacement tool, which is untrue and absolutely we need to be doing away with that narrative and look at it as from an augmentation to the current systems. And that's why we need to partner with credible systems. There is something like Johns Hopkins University's artificial intelligence certificate, which they provide. And there are other institutions who are also working on providing this AI and healthcare certifications. So overall, from a human resource point of view, I strongly believe that artificial intelligence with human resource development capacity can increase the capacity for various systems, but it is up to us of how we are going to use it as an augmentation tool versus anything else.
Wonderful. Thank you. And I think along the same lines, Ms. Elena, I'll come to you. So from your vantage point in digital innovation and AI governance, what would you say is, what would you say is the most significant AI trend shaping institutions today? And if you could share why you think that trend might be particularly relevant for African countries.
So we are witnessing a fundamental shift. AI is no longer a productivity tool or an experiment. It's becoming that infrastructure, and it's as essential as your electricity grids, telecommunication networks, transportation. And what I'm seeing across institutions, many are jumping towards AI. It's critical, and you do need that infrastructure, and that requires governance frameworks before that widespread deployment. So I'm seeing institutions and companies across the world jumping at AI, but potentially without that infrastructure in place. And this is actually very relevant for African communities for several strategic reasons. First, you have an opportunity right now to approach AI and be more deliberate about it. Western institutions are right now trying to retrofit governance into AI systems. They are deploying very fast, but they're also dealing with bias, accountability gaps, potentially vendor lock-in, and the public. So institutions can architect that governance and that foundation. Also, you need that capacity, that governance capacity, and that is a big differentiator. Countries that are going to be governing AI and being more deliberate about it and adopting AI, but also understanding that you need to make sure that you're addressing that bias, the regulations, the cost as well. And the point that was mentioned earlier, for AI, you do need that infrastructure. That means you need those foundations. And African populations are facing more unique challenges, I would say. And you asked me about trends. So some of the trends are, yes, leveraging AI, automating workflows, trying to see how we can speed up back-end office operations, documentation, transcription. I'm seeing hospitals, doctors leveraging AI to take notes, for example, or speed up that paperwork, that administrative piece. But you do need that very strong foundation, and you need that access to those resources.
Thank you. Those are really good examples. And maybe just building on that, back to you, Dr. Yogita. As you heard, of course, universities and institutes, and particularly low middle-income countries, are still exploring how to integrate AI responsibly. So could you share a little bit about sort of what practical steps institutions can take to adapt AI tools to improve teaching while also preserving academic integrity and critical thinking?
It's very interesting that you're asking this question. So one of the research, topics that I've been looking at is how AI is affecting the institutions of higher education. And the effect which we have studied so far is we are looking at 4 dimensions, which is curriculum and assessment, the pedagogical integration for students, faculty development, and institutional ethics and strategy. Now, given these 4 areas, within the curriculum, we are seeing that once AI comes into the picture, that there is a disconnect with regards to assessment. And all the assessment so far was, based on manual work, which is not really working anymore. When it comes to pedagogical integration, we are seeing that there's a lot of transactional use of AI, but critical thinking is missing from the dialogue. From faculty development point of view, we are seeing that faculty are themselves not comfortable with using AI, and their students are already using AI. So how is it that they are going to then, look at the students and who are already using ChatGPT do their assignments, but the critical component is missing. So faculty literacy is missing over here. And then institutions, like rightly said, that institutions are using AI in a very ad hoc manner. There's no deliberate usage over there. So now the question is, what is the role of researchers? What is the role of institutions who can, make strong mitigation techniques to not only retrofit AI, as spoken by my earlier speaker, but also to actually adapt it. So we are looking at strategies such as process-oriented evaluations, critical orchestration of dialogue, scaffolded adaptation, and responsible AI framework built into organization strategy. Now, these are going to be challenges that cannot be easily mitigated just by, speaking of them. Institutions will have to work to attain these, particularly, refined outcomes. So while we are seeing a lot of adoption, we are really not seeing any outcomes or any results. And for the results to actually show up, we'll have to make sure that AI is not treated as a mere tool, but it is also treated as a partner, as a learning partner, as a business partner within the higher education institutions, as well as within businesses.
Thank you. Very helpful. I'm sure we can spend an hour on just what you just said, but in the interest of time, but I appreciate those thoughts. So maybe just along the same lines, Alina, could you speak a little bit to sort of the barriers, again, building on what we just heard, that you see in implementing AI driven learning models, and basically, and maybe focusing specifically on the global health context and African countries, if you may.
So the barriers are that we need to recognize, yes, the data and AI literacy needs to be a priority, and governments are coming at it from different points of view, but some are recognizing that you need to start that AI literacy and education. For example, China has made it mandatory as early as grade 1. And US, in the response, said, okay, we are going to start AI literacy as early as kindergarten, with 8 hours every year of mandatory education in the schools. So, but at the same time, you have got other governments who are being more flexible about it and are not putting